guys, welcome back to my channel. My name is Chinelo and I'm an international student studying MSc Occupational Therapy here in the UK. If you're new here, please don't make it your last. Thank you for tuning in. And if you're a returning subscriber, hi guys, thank you for always coming back. This really means a lot to me. On this channel, I share my experiences about studying abroad. Please like this video and subscribe to my channel. Okay guys, on today's video, I'm going to be talking about occupational therapy. Like, this video is a video I promised I was going to do, so I have to fulfill this promise, and then I'm going to put it like in a playlist with other occupational therapy related videos. So if you're thinking about studying occupational therapy in the UK, I have a video where I talked about, you know, how to start your application, the process from start to finish. I'll put the link somewhere here, and then you can always refer to that video. And then I also have another video where I talked about the occupational therapy course overview, so you have an idea of what to expect. I'm just going to put the link of that video here. If you see it, you can just click on it and watch about occupational therapy. Okay, this is the question that is mostly asked. People are always asking me, what is occupational therapy? What do they do? Guys, it has nothing to do with occupational health. Occupational health is like a different field on its own. It's a different thing altogether. I feel like now is the appropriate time for me to do this video because now I have the experience. I'm on my second placement, so I can say, yeah, I know what occupational therapists do, apart from what you see online. But if you check online, you see a lot of definitions, but it won't really make sense because you've not really done practical. So I'm like, I'll just shoot this video when I'm ready, when I feel like I have experience and I can talk about occupational therapy. So I feel like now is the time. So guys, if you're thinking to study occupational therapy in the UK, you are at the right place. This video will really help you, so you have a little bit of an idea of what we do. Then you weigh your options to know if it's what you like to do. So let's start with definition. Occupational therapy is a healthcare course tailored towards helping people. The common thing that you find when you're looking at the definition of occupational therapy is you'll find occupational therapists, they help people live their lives to their maximum independence, to reach their maximum potential. So yeah, that's the common thing you see. You see independently live their life to their maximum potential. So that's what we do. It's therapy provided for patients who have had an injury or illness that have affected the way they perform their activities of daily living. It can be their self-care, their work, their leisure, or every aspect of their life. So OT, so it's called, the short is OT. So OTs, they help people restore function through meaningful activity or through purposeful activity. The word occupation there stands for activity. Therefore, there are various areas where people might need to be offered an occupational therapist input. Let's just get practical. For example, we work with neurological patients. If someone has stroke and they've lost like a function, like maybe they have like right side hemiplegia, in all cases you might not be able to get people back to function 100%, but what we do is find a way to compensate so that they don't feel like they've lost something because, oh, they had this illness. So you compensate and teach them a way they can still cope with this illness and still do what they're supposed to do. In this situation, an occupational therapist will come and help you, for example, teach you how to dress like one-sided. So there's something called one-sided dressing technique. So they teach you how to dress yourself one-sided. Before they discharge you, we go to your house, we check if your home is adapted enough. Before you had the stroke, everything was okay, your house was adapted for someone who has maximum capacity. So what we do is we go to your house, check if everything is all right, and then if things need to be adapted, adapt your toilet, put in frame handles where if you want to stand up from your toilet, you can easily stand up from your toilet, put toilet frames. If you're wheelchair bound, make it accessible for you, put in ramp so you're able to get into your house. We check if you need like a home lift. They're just going to say a lot. It might not be making sense now, but I'm trying to make it practical. I don't always get people back to 100% recovery. Try, however, sometimes it's about adapting their environment. So now my placement is for children with special needs, developmental delays, and just different disabilities. So typically, we take referrals from healthcare professionals. It has to be from a healthcare professional. It just has to be from a clinician. So when the child is being referred, you check it and check, okay, if the referral is appropriate or if it's not appropriate, and if we're going to accept the referral. We're going to accept the referral. We send a letter to the school, and also we send a letter to the parent. So they'll give school one and then they'll take one. It's called like a form you're supposed to fill before coming in for your first appointment. That form is just like has a drop down of questions. What areas do you think your child has these difficulties? So we break it down into self-care, fine motor skills, gross motor skill, social skills, your academic abilities, because we just need to ask these questions to find out where we think we need to help this child. It might be fine motor skills, so their handwriting, we need to check their handwriting, for gross motor skills, we need to check their balance. School will also fill the form and say what they think about this child. When they come into the clinic that day, the parents will come in with the 2 forms. When they get referred, the clinician that referred them will say where they think the child is having difficulties. For example, if a child comes in and they tell you, that their hands are hurting when they are writing, or they don't have, you see, they're clumsy, things are dropping down from their hands and all of that. So when the child comes, during assessment, we use standardized assessment, and then we use also clinical observation. These assessments they're already standardized. It gives them the assessment to do. It depends on the child and the one that is age appropriate for the particular child. Someone is just 7 to 10, depending, or they go all the way to age 70. So when you give them the assessment, you're assessing everything. We use the one for visual motor skill, we use the one for handwriting, we use the one for sensory function, just so you can find out different areas where you think that this child needs help. Okay, and then another practical example is my first placement was with a wheelchair clinic. So here in the UK, occupational therapists are the ones that give equipment to clients. For example, wheelchair, Zimmer frame. For some illness, they have to be wheelchair bound. So in the wheelchair clinic, so what the NHS do is, if you have like a disability and they know you're going to be wheelchair bound for some illness, like if you have like cerebral palsy, because they easily get fatigue, they will need wheelchair. Some of them, they're not able to walk very well, so they need wheelchair. And they give wheelchair because if for outdoor and indoor use, if it's just for indoor use, you're not eligible. With referrals, it still has to come from a clinician as well, and they assess the referral to check, example, what would you be using the chair for, how many hours do you think you'll stay in the chair for, where do you go, what kind of chair do you need, what functions do you have. If you don't have like your fine motor skills, they know that okay, you might not need a self-propel wheelchair, meaning that you cannot propel yourself. What you need is a transit chair. Maybe what you need might be a powered chair. Powered chair is an electric chair. So you come into the clinic, they assess you. Postural care as well, the postural analysis, because for some people there's something called pelvic obliquity, meaning like one pelvic is higher than the other. So it's, when you sit and then you're sitting like this, that means this place, there's going to be like a huge gap under your bottom when you sit down. Add wedges or add foam. So while they're on their chair, they're supported very well. If you need to put like a lateral support, if you need like a headrest to support their head, or they need like a harness. For some children with cerebral palsy, they're always jerking or shaking. So what you do is you put like harness, because they have these involuntary movements that they do. So you give a harness, but then it's not for restriction. It's just so that they are supported when they are seated, but it's not to restrict the child from moving. So yeah, if you meet all the criteria, you come in and then they take your measurement, they check the wheelchair that's appropriate for you. For someone that cannot self-propel, there's no point giving them a self-propel wheelchair. You give them a transit wheelchair, the one that someone can push them on the chair. But then if they can self-propel, you give them a self-propel chair. It's really adapted. You realize that how the UK is so, the system works. So you modify the wheelchair in a way that adjustments can be made for you. They give you a cushion, a pressure relief cushion, so you don't have like pressure sore while sitting on the chair. All of this can just be adapted. So everything is specific for your own need. So when you come in, we're asking you questions about what your difficulties are, what your activities are, how do you shower, what's your washing and dressing like, how do you get into the bathroom, how do you come out of the bathroom. Like, it's so detailed, guys. Like when we're asking these questions, sometimes people wonder, why do you need all this information? But then we need it because it's very client-centered. So one person can come in with a different need, another person will come in with a different need. So you're going to have to make it in a way that it's peculiar to that particular client. So yeah, I've given an example about children, not so detailed, but I'm sure you get it. And then about prescribing wheelchair. I haven't done ward. I think my next placement might be mental health or ward. So when I do that one, I'll still come back here. When I do ward placement means that I'll be put in a hospital ward. Different units, might be acute, it might be rehab, just different units. And then I don't know if I'm making sense. But this is just a tip of what occupational therapists do and how we operate here in the UK. Guys, if you've gotten to this stage of this video, please like this video, guys. Please like this video, give it a thumbs up, subscribe, share to your friends. Like sometimes I have like 200 and something views and I have 25 likes. I'm like, it does not add up. So yeah, just give it doesn't take anything away from you. It's very quick. Just click on it, and then I know people forget. That's why I'm always trying to remind people. And then subscribe to this channel. If you have questions about occupational therapy, studying occupational therapy in the UK, what we do, job prospects, all the numerous questions that people are always asking, just drop it down in the comment section and I'll answer your question. Okay, thank you for watching this video, and I hope to see you in my next one. Bye.